Usually when we talk about getting a medical diagnosis, there is this underlying expectation of precision. It feels almost like engineering, right?
Oh, absolutely. Like fixing a car.
Yeah, exactly. Like
Yeah.
if you break your arm, you go to the hospital, they take an x-ray, and you get that stark black and white image. There's a jagged white line, and the doctor points to it and says, there it is. That is the problem.
Right. And we definitely crave that kind of binary simplicity. I mean, there is a deep psychological comfort in being able to visually categorize a problem as, either broken or intact, diseased or healthy.
But then you step into the cutting-edge world of cellular biology and regenerative medicine, and suddenly that comforting x-ray machine it's completely useless. We are looking at a biological landscape that is incredibly murky.
Murky is probably putting it mildly, honestly.
Yeah. Right. And whether you, listening right now, are actively exploring the latest wellness therapies to sort of turn back the clock, or you are just insanely curious about where the future of medicine is heading, well, today's deep dive is designed to separate scientific fact from some very aggressive marketing fiction.
Because we are diving into a space that is evolving so fast, the regulations are essentially eating its dust.
Totally. So for today's deep dive, we are focusing on the explosive rise of stem cell exosome therapy. And specifically, we're looking at a highly sensitive, rapidly growing application, which is its use in intimate aesthetic gynecology.
Which is a huge market right now.
Huge. And we are going to explore the critical and frankly often overlooked questions about tissue stability and safety. And to do this, we've got a massive stack of sources today.
Well, we really do.
Yeah, we're pulling from the glossy marketing materials of aesthetic clinics like the Longevity Medical Institute and the Bioscience Institute, but then we are holding those up against strict medical advisories from the Women's Health Clinic.
Right, and alongside some very dense oncological research papers that analyze the complex cellular behavior of these therapies.
Exactly. So the mission for this deep dive is to unpack what exosomes actually are at a structural level, why they are currently being touted as a miracle for intimate rejuvenation, and critically, why the severe lack of long-term safety protocols means you need to proceed with extreme caution.
Right, because of their dual role in cancer biology. We have to look past the beautiful brochures and really understand the cellular reality of what happens when you introduce these compounds into the human body.
So before we get into the safety risks and the cosmetic boom, I think we really need to understand what an exosome actually is, because for years, at least in the mainstream media, the holy grail of regenerative medicine was the stem cell itself.
Yeah, for a long time, the entire focus of regenerative medicine was on the concept of cell replacement. Like the idea was to take live, healthy stem cells, introduce them into a patient's damaged tissue, and just, hope those new cells would engraft, survive, and essentially replace the dying tissue.
But that didn't always work out, did it?
No, not at all. But as the science evolved, researchers made this profound discovery. The therapeutic benefit wasn't necessarily coming from the stem cells replacing tissue.
Yeah.
The magic was actually in what the stem cells were secreting into their environment.
Okay, so I read this analogy in the notes, and it completely changed how I picture this. So think of a stem cell as a sophisticated cellular command center.
Okay, I like that.
It sits in your tissue, assessing the damage around it. But the command center doesn't actually go out and do the physical repair work on the front lines. Instead, it sends out a text message or like a highly programmed delivery drone to tell the local workers what to do. The exosome is that delivery drone.
That visual captures the mechanism perfectly. If we look at the source data, exosomes are microscopic, cell-free vesicles.
And when we say microscopic,
We mean incredibly small. We are talking about structures measuring between 30 to 150 nanometers in diameter.
which is hard to even visualize.
Right, so to put that in perspective, a single strand of human hair is about 80,000 to 100,000 nanometers wide.
Yeah.
You could fit thousands of exosomes across the width of a single hair.
So they are unfathomably small, but what are they actually carrying? Like what's inside the drone?
Well, despite that tiny size, they carry a highly potent, highly specific payload. They are packed with proteins, growth factors, messenger RNA, and microRNA.
Wow.
Yeah, they're essentially little biological envelopes filled with genetic instructions.
But they aren't alive, right? I mean, they aren't cells themselves.
Correct, they are just the envelopes. They operate through a process called paracrine signaling. And this is basically how cells talk to each other locally.
Okay.
So when an exosome reaches an aging or damaged cell, its outer lipid layer fuses with the target cell's membrane, and it drops that payload of genetic blueprints inside.
Oh, wow. So it just slips right in.
Exactly. And those blueprints literally alter the behavior of your existing cells. So they might instruct a cell to turn down an inflammatory response or, tell a fibroblast cell to start aggressively manufacturing new collagen, or even signal the local tissue to build new blood vessels.
It's like slipping a new blueprint to a factory worker. You aren't replacing the worker, you're just telling them to build something different.
That is exactly the right way to think about it. And the source of these blueprints matters immensely. The data shows that mesenchymal stem cells, or MSCs, they currently dominate about 45% of the exosome therapeutics market.
Okay, and where do those come from?
MSCs are often harvested from bone marrow, umbilical cord tissue, or fat, and they're heavily favored because their specific exosome payloads are incredibly rich in regenerative and anti-inflammatory signals. Plus, they are relatively robust to cultivate in a laboratory setting.
And here's why this specific structural difference matters so much to you as a listener. Because exosomes are cell-free, so they are just the messenger drones, not live, whole cells with their own complex immune profiles. They carry a drastically lower risk of immune rejection.
Right. That's the key.
Because if you inject someone else's live cells into your body, your immune system will probably attack them as foreign invaders.
Oh, almost certainly. Your body recognizes they don't belong.
But an exosome, it slips right past the guards. I read they can even cross formidable biological barriers in the body, like the blood-brain barrier.
Yeah, it really represents a fundamental paradigm shift in medicine
Right.
because you are leveraging the body's natural communication network to orchestrate healing from within,
Hmm.
rather than trying to force foreign cells to survive in a hostile, damaged environment.
Which sounds amazing.
It is, but the ability to effortlessly cross biological barriers and rewrite cellular behavior, it's a massive double-edged sword.
Which brings us to the absolute explosion of this market. Because these delivery drones can dodge immune rejection and trigger massive cellular repair, aesthetic clinics are rapidly applying them to highly sensitive areas of the body.
And the growth curve is just staggering. The global stem cell exosome therapeutics market is projected to surpass $3.5 billion by 2030.
That is wild.
It is, and one of the fastest growing yet most controversial sectors driving that boom is aesthetic gynecology.
Yeah, I was looking at the marketing materials in our sources, and it's wild how this is positioned. Aesthetic gynecology is essentially blending dermatology, urology, and plastic surgery.
Right.
Clinics are using exosome products to treat conditions like genitourinary syndrome of menopause or GSM, which, includes vaginal atrophy, dryness, and tissue laxity.
Yeah.
One brochure for a product called Supplus Intimate Care literally boasts that it delivers 5 billion high-purity rose stem cell-derived exosomes per treatment.
5 billion. And we really have to look at how they are physically applying those billions of exosomes. In these clinics, the exosome serums are often applied immediately following a non-ablative laser treatment or a radiofrequency session.
So wait, they are zapping the tissue first.
Yes. Those energy devices are designed to create controlled microdamage, essentially tiny thermal wounds in the sensitive mucosal tissue.
Ouch. Okay.
Well, the body's natural response to a wound is to rush blood and repair cells to the area, right? So by applying the exosomes immediately into those fresh micro wounds, the theory is that the highly concentrated growth factors will dramatically accelerate the healing process.
Ah, I see.
Yeah, they claim it thickens the tissue and stimulates a massive surge in new collagen production. And in some more aggressive protocols, clinicians are even injecting the exosome solutions directly into the submucosal tissue with a needle.
Wait, if these exosomes are essentially just biological grow commands, like they're yelling at the tissue to build new blood vessels, multiply, and thicken up, what happens if they tell the wrong cells to grow? Like if they are dropping a blueprint that says multiply rapidly, isn't there a massive risk if that blueprint gets handed to a mutated cell?
You have just hit on the exact reason why organizations like the Women's Health Clinic have issued extremely sobering medical advisories regarding these treatments.
I mean, it seems like a glaring issue.
It is. The glossy marketing promises a safe, magical reset button for intimate health, but the clinical reality is far more precarious. First, we need to establish the regulatory baseline here. Currently, there are absolutely no exosome products approved by the FDA for any medical condition whatsoever.
None, because I feel like I see ads for them everywhere.
Not a single one is FDA approved. The aesthetic industry frequently uses terms like regenerative or clinically proven in ways that sound really authoritative, but they are not backed by the rigorous, multi-year, placebo-controlled human trials that are required for FDA approval.
That's a huge distinction.
Exactly. Clinics might promise that your results will last 6 to 12 months, but the clinical sources clearly state These timelines are just anecdotal estimates.
So people paying thousands of dollars for this are essentially participating in an unmonitored experiment.
They are. And this leads to a critical warning from the clinical guidelines. Providers must definitively separate a patient's symptom assessment from a trendy aesthetic treatment label.
What does that mean practically?
Well, for instance, a patient might experience pelvic pain, extreme dryness, or unexplained bleeding, and just assume it's a standard symptom of menopause. They might seek out an exosome treatment for cosmetic rejuvenation, but unexplained bleeding can be an early indicator of endometrial or cervical cancer.
Oh, wow. So if a clinician just says, sure, let's inject some exosomes to fix that dryness without doing a full diagnostic workup.
They could be pouring highly potent growth factors onto an undiagnosed malignancy. You simply cannot throw an unapproved concentrated growth signal at a symptom that hasn't been properly diagnosed through pathology.
That thought leads us directly into the core safety concern of this entire deep dive. The clinical guidelines explicitly state that caution should dramatically increase for patients with any history of cancer, previous pelvic radiation, or unexplained bleeding.
Yes, absolutely.
And to understand why, we really have to dig into the dense oncology research in our stack.
Because when you look at the oncology data, the narrative around exosomes completely flips. They're not just benevolent little healers. Because exosomes are the body's primary, most efficient communication network, tumors actually actively hijack them to survive and spread.
How does a tumor hijack a communication network? Like mechanically, how does that work?
It's actually a brilliant, albeit terrifying, evolutionary tactic. Cancer cells manufacture and release their own specific exosomes, packed with mutated instructions. They use these tumor-derived exosomes to suppress the local immune cells. They essentially blind the white blood cells that should be attacking the tumor.
That is so sinister.
It gets worse. Tumors will also send their exosomes out into the bloodstream to prepare what is called a pre-metastatic niche.
A pre-metastatic niche. What is that?
Think of it like sending advanced scouts to fertilize the soil in a distant organ before the actual cancer cells even migrate there.
Oh my God.
Yeah. The tumor's exosomes arrive in, say, the lungs or the liver, and instruct the healthy tissue there to start building a blood supply and a welcoming environment for the cancer cells that will eventually follow.
That is horrifying. But what about the exosomes being injected at the clinics, like the ones derived from stem cells?
That is where the data gets highly concerning. Let's look at adipose-derived stem cell exosomes, which are often abbreviated as ADSC exos. These are derived from fat tissue and are very, very popular in regenerative therapy.
Right, because fat is easy to harvest.
Exactly. But the oncological sources reveal that in the specific context of ovarian tumors, ADSC exos can actually promote tumor progression and peritoneal metastasis.
By doing what exactly?
Well, they activate specific cellular domino effects, most notably something called the MAPK signaling pathway.
Okay, the MAPK pathway.
Right. Think of a cell as having an internal engine. The MAPK pathway is essentially the gas pedal. In a healthy cell, that pedal is pressed when the cell needs to divide to heal a cut or scrape.
Makes sense.
But the research shows that these fat-derived exosomes can act like a brick laid on that gas pedal. They drive rapid, uncontrolled cancer cell proliferation and help the tumor grow new blood vessels to feed itself.
Okay, let me make sure I am fully grasping the implications here. If a clinician is injecting these incredibly powerful messenger vesicles into highly sensitive, intimate tissue to treat, say, vaginal atrophy,
Right.
and there happens to be an undetected microscopic cluster of mutated precancerous cells nearby, we could accidentally be handing a megaphone to a microscopic tumor. Like, we could be giving it the exact growth factors and blood supply it needs to aggressively spread.
That is the exact oncological elephant in the room. Which brings us to the most glaring void in this entire industry. When we ask the question, what long-term surveillance protocols monitor tissue stability and oncological safety following intimate exosome therapy? The chilling answer from our source material is that standardized long-term surveillance protocols simply do not exist.
Wait, because this is being done under the umbrella of aesthetic or off-label use, nobody is tracking these patients 5 or 10 years down the line to see if their tissue remains stable.
No. There is no universally mandated registry tracking long-term cellular outcomes for these specific intimate applications. Clinicians are operating without a long-term safety net.
That is insane.
It really is. This is precisely why the medical advisories from organizations like the Women's Health Clinic are so strict. Providers are warned to watch for any clinical red flags and to absolutely avoid this therapy in patients with any history of cancer or immune conditions.
It sounds like both the clinician and the patient are flying completely blind here.
The burden of product safety basically falls entirely on their shoulders. Without FDA oversight, you are relying entirely on the manufacturer's internal quality control. So, the clinical sources stress that providers must rigorously verify USP and ISO manufacturing standards.
What does that mean in practical terms? Like, what are they looking for?
Well, they have to ensure the exosome product is completely free of endotoxins, which are toxic substances released by bacteria,
Okay.
as well as mycoplasma, which is a type of bacteria that can silently contaminate cell cultures and, any viral pathogens. Furthermore, exosomes are incredibly fragile.
Because of that little lipid envelope you mentioned?
Yes, if their protective outer shell, the lipid bilayer, isn't preserved correctly through strict cold chain storage during shipping, or if the particle concentration is miscalculated by the lab, the treatment won't just be ineffective, you are actually risking severe localized tissue ischemia,
Ischemia, meaning what?
where the tissue literally dies from a lack of blood flow.
Mm.
Or you could risk massive localized infections.
Wow. So we have this biological delivery drone. In the unregulated aesthetic world, it's being injected into sensitive tissue to turn back the clock, carrying this massive unmonitored risk that it could accidentally feed a tumor.
Right.
But if we flip the script, the exact same biological mechanism, the fact that these exosomes carry the genetic blueprints of their parent cell, is currently revolutionizing the highly regulated world of oncology. Because if these things are just messengers, scientists are figuring out how to intercept the message, right?
It is a stunning paradox. The very characteristic that makes them a dangerous wild card in a cosmetic clinic makes them an incredibly valuable diagnostic tool in a cancer ward.
Because they carry the tumor's blueprint.
Exactly. Because exosomes carry the distinct molecular signature of their parent cell, a growing tumor is constantly shedding millions of its own tumor-derived exosomes into the patient's bloodstream, urine, and saliva.
So instead of injecting lab-grown exosomes into the body, oncologists are designing ways to catch the body's own exosomes.
Precisely. This is the foundation of the liquid biopsy.
Liquid biopsy.
Right. Traditionally, diagnosing a tumor requires a physical tissue biopsy. That means an invasive, sometimes painful surgical procedure to cut out a piece of the tumor. But beyond the pain and the risk of infection, physical biopsies have a major limitation, which is that tumors are heterogeneous.
Meaning they aren't just one uniform type of cell.
Right. A tumor is made of many genetically diverse cell populations. If a surgeon takes a single needle biopsy, they're only grabbing one tiny sample of a vast landscape. They might accidentally miss the most aggressive mutated part of the tumor entirely.
Oh, right, because they just poked the wrong side of it.
Exactly. But a liquid biopsy using exosomes changes that completely. Because those tumor exosomes are incredibly stable in circulation, protected by that little lipid shell, scientists can take a simple vial of blood and capture a comprehensive snapshot of the entire tumor's genetic diversity.
The technological advancements making this possible are remarkable. I mean, the sources detail microfluidic devices like the ExoSearch chip and the ExoScreen method.
Yeah.
These tools essentially act like highly targeted fishing nets, right? They use specific antibodies and magnetic nanosensors to pull the tiny exosome vesicles out of a complex blood sample, completely bypassing the need for days of complicated laboratory purification.
Yeah, it's brilliant.
I saw some of the specific data on this in the notes, and the precision is wild. Researchers can analyze the blood, catch these exosomes, and find specific mutant messenger RNA, like one called EGFRV8.
Yes, which acts as a highly accurate biomarker for glioblastoma, a very deadly form of brain cancer.
Right. Or they can look for elevated levels of a specific protein, like TSPAN1, to detect colon cancer early.
And this isn't just theoretical bench science.
Wow.
This is being tested in massive clinical populations right now. The sources highlight the Destinex clinical trial.
Oh, yeah, the Destinex trial.
They recently completed a study with over 800 subjects, specifically analyzing exosomal microRNAs in the blood to detect early-stage gastric cancer.
Which is huge, because gastric cancer is notoriously difficult to catch before it becomes advanced.
Exactly. But these circulating exosomes could introduce a highly sensitive, non-invasive screening method.
Catching it early is the entire ballgame.
It is the holy grail of oncology. Furthermore, Because exosomes change their cargo as a tumor evolves, they offer a window for real-time monitoring.
Oh, like watching it adapt in real time.
Exactly. An oncologist could assess if a patient is developing resistance to a chemotherapy drug just by drawing blood every few weeks and analyzing the exosomal cargo. They could see the cellular changes long before a new resistant tumor mass would ever show up on a traditional MRI.
The irony here is just staggering when you look at both sides of the coin. On one hand, you have the booming cosmetic and anti-aging industry, charging patients thousands of dollars to inject unapproved, lab-grown exosome growth factors into sensitive tissues.
Operating completely without long-term surveillance protocols.
Right. While medical guidelines are screaming for caution because those vesicles might unwittingly feed an invisible cancer. But then, on the other hand, in the rigorous world of oncology, capturing those exact same naturally occurring exosomes from your blood might be the very key to detecting that invisible cancer and saving your life.
It beautifully illustrates the absolute neutrality of biology. Exosomes are fundamentally unbiased. They're just the postal service of the human body. The danger or the life-saving potential lies entirely in the message being sent and the biological context of who is sending it and who is receiving it.
So, as we wrap up this deep dive, what does this all mean for you, the listener? If we summarize the landscape, stem cell exosomes represent an undeniable, incredible leap in our understanding of cellular biology.
They absolutely do.
They are potent messengers capable of crossing barriers, calming inflammation, and repairing tissue at a fundamental level. But right now, specifically regarding intimate aesthetic applications, we are operating in the Wild West.
We are. So if you take away anything from the clinical guidelines we've explored today, let it be this. If you are ever considering these therapies, you must be your own most rigorous, educated advocate. Do not let slick marketing or the promise of a quick fix bypass a proper, thorough medical diagnosis.
Yeah, you have to ask questions.
Always ask your provider for product-specific evidence. Ask them about the regulatory context of what they are injecting. And crucially, ask about their emergency protocols for localized tissue ischemia or infection.
Because if they don't have an answer,
If a clinic brushes off the risks, or if they promise guaranteed permanent results without acknowledging the lack of long-term surveillance protocols, that is a massive red flag.
you really have to respect the biology. I mean, these aren't just fancy, expensive moisturizers. These are complex genetic instruction manuals.
Exactly. Knowledge and critical thinking are your absolute best defenses against information overload and aggressive medical marketing.
Which leaves us with one final, deeply provocative thought to ponder long after this deep dive ends. We know that exosomes can effortlessly cross biological barriers. We know they deliver specific mRNA blueprints directly into target cells.
Right.
And we know that oncologists are currently mapping the exact unique exosomal signatures of different types of cancers. So if we can intercept and read the enemy's mail, how long until we learn how to write our own?
Wow.
Could we one day bioengineer our own artificial exosomes like microscopic assassins programmed to hunt down those specific cancer signatures and deliver instructions exclusively to precancerous cells, stopping a tumor before it ever has the chance to form?
It is a fascinating frontier. We would literally be turning the tumor's own sophisticated communication network into a weapon against it.
It really makes you look at that old, reliable X-ray machine a little differently. We might be leaving the comfort of that clean, jagged white line behind and stepping into some very murky diagnostic waters. But eventually, those waters might reveal the foundational building blocks of life itself.